Coronary vessels are those blood vessels that take part in the coronary circulation. That is actually the functional blood supply of the heart, and this is the shortest circulation in the entire body. These coronary vessels include coronary arteries and coronary veins. Starting with coronary arteries. The coronary arteries are responsible for supplying the heart itself with oxygenated blood. The first two aortic branches that supply blood to the heart tissues are called the right coronary artery and the left coronary artery. They lie just beyond the aortic valve. Both of these coronary arteries enclose the heart in the coronary sulcus that we have already seen and provide the arterial supply of the coronary circulation. The left coronary artery runs toward the left side of the heart, whereas the right coronary artery runs toward the right side. The left coronary artery then divides into the anterior interventricular artery and the circumflex artery. The anterior interventricular artery is also known as the left anterior descending artery. It supplies blood to the anterior walls of both ventricles and to the interventricular septum, whereas the circumflex artery supplies the posterior walls of the left ventricle and the left atrium. On the other hand, the right coronary artery divides into the right marginal artery and the posterior interventricular artery. That can be seen on the posterior side of the heart. The right marginal artery serves the myocardium of the heart's lateral right side. There also may be more than one marginal artery, while the posterior interventricular artery supplies the posterior ventricular walls and runs to the heart. Apex. It merges or anastomoses, means makes connection, near the apex of the heart with the anterior interventricular artery. Coronary artery branches supply many capillaries in the myocardium. These arteries have smaller branches with connections. Some of these branches include atrial branches, conus branches, and branches to the sinoatrial node. There is considerable variation in the size and distribution zones of the coronary arteries. For example, in some people, the posterior interventricular branch of the right coronary artery is large and supplies a large part of the left ventricle, whereas in the majority, this is supplied by the anterior interventricular branch of the left coronary artery, and so on. Now, after the arterial supply of the heart, let's learn about the venous drainage of the heart via coronary veins. The coronary veins are basically located along the same paths as the coronary arteries. To have a complete view of coronary veins, we will look at the posterior side of the heart. The coronary veins from all over the myocardium join to form the enlarged coronary sinus, emptying into the right atrium. On the posterior aspect of the heart, the coronary sinus can easily be seen. Three main divisions of coronary veins that enter the coronary sinus are great cardiac vein, middle cardiac vein, and small cardiac veins. Also, several anterior cardiac veins empty into the right atrium's anterior portion. The posterior cardiac vein also empties into the great cardiac vein or coronary sinus. The coronary sinus then empties directly into the right atrium. This was all about the coronary vessels involved in the circulation or blood supply of the heart.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.